Hi there, my name is Peter Gebbett and I convene the Eltham Prostate Cancer Information and Support Group. This presentation is about prostate cancer and how an information and support group can help a man and his family better survive a prostate cancer diagnosis. I've been involved with the group for 14 years and I've been through a diagnosis and treatment of prostate cancer. Just a reminder about prostate cancer. In Australia, around 17,000 men are diagnosed each year. Unfortunately, we lose just over 3,000 men every year. And amazingly, there are 260,000 men in Australia that are living with prostate cancer. Unfortunately, the risk of suicide does increase after diagnosis, especially with men with no support. And peer support can reduce the psychological stress associated with prostate cancer diagnosis and dealing with the ongoing treatment. In the recent statistics have come out about the northeastern suburbs of Melbourne, where we live, and it shows nearly 4,000 men are living with prostate cancer in our area, and over 300 men are diagnosed every year in the northeastern suburbs. This slide shows the survival rate of men diagnosed in our area compared to the rest of Australia. And what can be seen here is that we have a slightly higher survival rate of 84 men out of every 100 that survive for at least 5 years, which is a good number. However, at the bottom of the slide, it shows the 4 different stages of cancer when it's first diagnosed. And what it shows here, as can be seen with the section here, is that we have 66.8% of our men are diagnosed at stage 2, compared to the rest of Australia that only has 47% of men that are diagnosed at stage 2. What we want to do is get more men being diagnosed at this earlier stage, at stage 1. So we're way down on the rest of Australia. We're almost half of the rest of Australia that are being diagnosed early in their journey of prostate cancer. The earlier you can be diagnosed, the more chance that you've got of a higher survival rate. The fantastic number on this table, however, shows that at the very end, stage 4, which is the worst time to be diagnosed, we are actually well in advance of the rest of Australia when it comes to stage 4 diagnosis. This diagram may be a little confronting, but many men have no idea where their prostate is or what it does. It sits below the bladder and has the urethra run through it that delivers urine when you go to the toilet. It also is involved in producing some of the fluid to assist in delivering sperm from the testicles. All of this is an important organ in men's reproductive system. This slide is blank because there are no early symptoms of prostate cancer. That's why we recommend you talk to your GP if you're over 50 years of age about a PSA blood test, or if you're over 40 and there is a family history. A simple blood test, like having your cholesterol checked, can be a good indicator. Information and support groups about prostate cancer have been in Australia for well over 20 years. We now have over 120 groups in Australia. Here in Victoria, we have about 23 at the moment. The nearest groups in the northeastern suburbs are Eltham and Heidelberg. And most groups meet once a month. Some meet during the day, some meet at night. The Eltham group meets at night. The Heidelberg group meets during the day. A support group helps reduce the feeling of loneliness in dealing with prostate cancer. Men don't feel isolated, they feel supported. They get tips and hear from others, they meet others, and they receive and provide support. Who should attend a support group? Anyone wanting information about prostate cancer should attend a support group. In particular, anyone newly diagnosed. I believe these men, they get the most out of attending a support group in that they get to hear about all the different types of treatments that are available. Unfortunately, sometimes when they get diagnosed, they don't hear everything at the diagnosis and they don't understand all the different issues. So by talking at an open environment, at a support group, you get to ask a lot more questions. Also, anyone with side effects from treatments, and anyone with prostate cancer who wants to help others. And of course, anyone who wants to help the group support the community. Partners and family are very welcome to attend the group. Particularly partners are affected by the diagnosis, and often partners or their children do the research. I've had many phone calls about our group from partners and children because it impacts their relationship emotionally, physically and mentally. Partners find relief in speaking with others as well, and many partners can feel left out of the decision making. Most groups have women attending, and the group's there for the support of the whole family. These are some quotes from people that have attended support groups in the past. I'll let you read them in your own time just to give you a feel from what people have said. I think the important thing about the group is that we have shared experiences that we help others. It brings men together, all with the one cause that we're interested in. There are no agendas and everyone is equal. And the other thing that we do is we have a common interest in raising awareness of prostate cancer with some public talks in our community. This is an attempt to give you an idea of the typical type of man that attends a support group. This little frog is obviously holding on for dear life before this stalk consumes him, and most men that attend a support group are there to try and find out as much information as they can to help them live a long life. The Eltham Prostate Cancer Information and Support Group has been in existence for 17 years. It's confidential and it's also free to attend. We meet monthly at the CFA in Eltham on the third Monday at 7 p.m. and we've helped over 200 men in our community over these years. If you do attend, there's no obligation or requirement to continue to attend. And a very important point I'd like to make is that we provide no medical advice. None of us have any qualifications, and all we do is we share our own experiences. We do have from time to time professional speakers, which include doctors and specialists. And we do have a prostate cancer nurse that's associated with our group. She is at the Austin Hospital and does attend our group from time to time. We are affiliated with the Prostate Cancer Foundation of Australia, and we're supported by the Cancer Council of Victoria. What our group needs is more men to share their story and help others. We also need more people to help us run the group, and we need more people in the community to know that we exist. Just to finish, we meet 7 p.m. on the third Monday of every month at the Eltham Country Fire Authority building. Or we do have Zoom meetings, and you can contact us if you want the details for the Zoom connection. We have a mobile number which you can call, an email address that you can send a request to, or of course you're already on our website. Thanks for your listening into our presentation.